Several hundred new laws came out of Florida's legislative session, and while critics say that little to no progress was made in the highly anticipated issue like insurance reform and housing affordability, progress was made in the arena of mental health. Take a look. Senate Bill 1620 makes changes to Florida's Mental Health Act by strengthening the state's Baker Act. Based on recommendations from the state's Commission on Mental Health and Substance Use Disorder, it standardizes clinical mental health assessments that are used by providers and school mental health programs. SB 1620 took effect in July. It requires individualized treatment plans for adults and minors who are Baker Acted, and that they be reevaluated once every 6 months at minimum. It requires biennial reviews for short-term residential treatment facilities, especially in underserved and high-need areas, and prioritizing licensing of these short-term facilities. It changes the language used in professional medical settings to emphasize the patient as a person instead of defining them by their illness. Experts call this person-first language. Senate Bill 168, known as the Tristan Murphy Act, expands the Criminal Justice Mental Health and Substance Abuse Reinvestment Grant Program. SB 168 for short will take effect in October. It allows police, prosecutors, and judges to prioritize treatment rather than incarceration in cases involving nonviolent offenders with serious mental health illnesses. It requires mental health evaluations for people with history of court rulings of mental incompetency and provides pretrial mental health support. It expands training for 911 dispatchers. It mandates mental health screenings within 24 hours of jail booking. And it expands the use of diversion programs, reducing the number of people with serious mental illnesses from entering the criminal justice system, instead diverting them to community-based treatment and support services. This new law is named after Tristan Murphy. The Charlotte County man suffered from schizophrenia, was in and out of jail, and died by suicide in prison 4 years ago. Tristan was 37 years old. Joining us now is State Senator Darryl Rouson, a champion in the arena of mental health legislation and also a champion adding resources in the treatment of addiction. Senator Rouson, thank you so much for coming in.
Thank you so much for having me.
You have been part of the commission that looked at different pieces of data and research in order to make recommendations that were ultimately adopted in SB 1620. What was the most striking piece of research data that you saw?
Well, I think I should thank the Commission, first of all, for its good and hard work to pull together all the data. But what was striking to me was the number of Baker Acts. Even though it has decreased over the years, it's still very significant that 160,000 Hillsborough residents were Baker Acted last year. And we need to do something about getting these folks help when they're in crisis, and not arresting them and putting them into physical custody.
What was how does SB 1620 help address that issue of patients who are Baker Acted and then end up in the criminal justice system? What specific measures are you most proud of in SB 1620?
The fact that it will require mental health screening within 24 hours of an arrest.
You have been part of the state legislature for so many years. When you look at the conversations around the Tristan Murphy law, and we're talking about folks who are in the criminal justice system, between mental health and the topic of prisoners, those are both not very popular topics. How was the conversation different this time around where you were able to get new legislation on this?
Well, in the 17 years I've been going to Tallahassee, I can tell you there's been a palpable, distinct difference in reducing stigma from when we first had these conversations. And it has become more bipartisan. It is neither a Republican or a Democratic issue. It's a human issue. It's about not incarcerating those who need attention for mental wellness.
One of the things that the University of South Florida has done is name its center, its Substance Abuse and Mental Health Research Center at the USF Luis de la Parte Florida Mental Health Institute in your honor. What was that moment like when you received that news?
It was quite an honor, and it was quite a humbling moment. But when you realize the body of work that I've done with mental health and substance use disorders, I think it's a very fitting opportunity for more work to be done. It's not about the honor, it's not about the name, it's about preparing next generation leaders to deal with a very defining challenge of our time, and that's mental health and substance abuse.
The Research Center at USF will be conducting sustained research that will contribute to workforce development and things like that. What are some of the other areas that you're proud of, of the work that will be done there?
Well, the peer specialists, it will build upon that. In fact, what we say in the program of recovery, the therapeutic value of one addict helping another is without parallel. And to the extent that those who have lived experiences can reach back and help those who are going through will be monumental. And
sharing those lived experiences is something that you have done for many years. When you visited recently the facility that helped you in that final moment of treatment, what was that like, and what has been the reaction when you share your story?
Well, it was a shiver bump moment, if I can borrow an old phrase. Going back to where I last got clean and realizing the broken condition that I was in and how they helped me build up to what I ultimately embraced, and that was a program of recovery.
Tell us about the visit to Palm Beach when you spoke there was someone in particular that you were looking forward to meeting. Tell our viewers about that.
Well, my last counselor in treatment, in fact, people always ask, well, which treatment was the best treatment? I say the last one. Which counselor was the best counselor? The last one. And his name was Bob Rouson. And his son, who's now a lieutenant with the Palm Beach County Fire Department, was able to come and hear me tell my story. And it's come full circle. His father was there saving lives, saving my life, helping me to look at my issues and address them. And now he's riding to scenes, emergency rooms, overdose settings, and taking people to treatment. So he's doing what his father's work was. And I had a great chance to visit with him.
How old was he when you first met with his father?
He had to be all of 12 or 13 years old.
That's incredible. Is there anything else that I've not asked you that you'd like to share with our viewers before we go to the next segment?
Well, just that we need to stop locking people up in jail, incarcerating them for what could be a good diversion to mental health.
Senator Darryl Rouson, thank you so much for joining us.
Thank you for having me.